Hi, everybody. Welcome to the KSB virtual presentation on mammogram guidelines. My name is Dr. Joyce Johnson. I am a family medicine physician that works out of the Town Square Center with KSB Hospital. My focus includes full spectrum family medicine, including pediatrics and obstetrics. And I'm here today with my colleague and friend, Dr. Emily Bocker. Dr. Bocker, do you want to introduce yourself?
Thanks, Dr. Johnson. As she said, I'm Dr. Emily Bocker. I am also a full spectrum family medicine physician. I work both out of Town Square Center at the Family Health Center and the KSB Amboy Clinic, doing obstetrics, pediatrics, nursing home work, and just full spectrum family medicine. So today we want to talk to you about recommendations for breast cancer screening, taking into account the risk of developing breast cancer, other parameters that might affect screening decisions, and the benefits and harms of screening. Most breast cancers in the United States are diagnosed as a result of an abnormal screening study. That's why this topic is so important to cover.
So we wanted to just talk about screening in general, and keep in mind that screening is of greatest value for individuals who are most likely to develop breast cancer. So you have to kind of determine what your risk is as you head into having this conversation with your family doctor. The average person is about 12% risk of developing breast cancer. And women who have a moderate risk are closer to the 15 to 20% chance. And higher risk women have greater than 20% chance of being diagnosed with breast cancer. Dr. Bocker is going to tell you what some of those major risk factors are.
So some of those risk factors include a personal history of breast, ovarian, tubal, or peritoneal cancer. Same thing with your family. If there's a family history of breast, ovarian, tubal, or peritoneal cancer, that puts you at a higher risk as well. If you have an ancestry associated with BRCA1 or 2 mutations, you're at higher risk. If you're a known carrier of a pathogenetic mutation for a hereditary breast or ovarian cancer syndrome yourself or in a relative, that puts you at higher risk. If you have dense breast mammography, that puts you at higher risk. Previous biopsy indicating a high-risk lesion. The age of menarche, the age of your first live birth, the number of pregnancies you have, and your menopausal status also modify your risk for breast cancer development. If you had radiotherapy to the chest between 10 and 30 years of age, you are at a higher risk for developing breast cancer. Women who do not have any of those risk factors are what we consider average risk.
Okay. And it's important to remember that age is something to consider. So if you are under the age of 40, it's very unlikely that you're going to develop breast cancer. It's not impossible, but it's unlikely. But of course, as you get older, that risk is going to go up. So breast incidence is quite low under the age of 40, but as you get older, it rises. So there's no screening guideline specifically that recommends screening average risk women under the age of 40. So that's another important thing to remember. If you don't have risk factors, you're likely not going to be offered breast cancer screening with a mammogram under the age of 40.
So the next age group we're going to talk about is age 40 to 49. It used to be that everyone was just supposed to start mammograms at the age of 40 and have a yearly mammogram until they died, basically. But now the recommendations are changed a little bit. And what we recommend for women who are aged 40 to 49 in the United States is that we have shared decision-making between your physician and yourself. There are benefits to screening, obviously, but there are some harms potentially as well. So if you and your physician work together to decide what's best for you, that's probably the most beneficial way to approach it. For average risk women in their 40s, we want to answer your questions, see what concerns you may have about screening, and then proceed from there. If you do decide to start mammograms in your 40s, it's recommended that you do a mammogram every 1 to 2 years. Expert guidelines do vary in recommendations about when to initiate screening and how frequently to screen. So some of what we're seeing depends on which guideline is being followed at that time. So for example, the American Cancer Society recommends that routine mammography screening start at age 45 based on the finding that people who are 45 to 49 are more similar to the 50 to 54 age group and their overall risk compared to the 40 to 44 year old age group. So the American Cancer Society recommends continuing annual screening until the age of 55 and then decreasing to every 2 years.
So let's talk about that age 50 to 74. Breast screening with mammogram is suggested for average risk women of this age group every 1 to 2 years, depending on the individual women's risk and, of course, their preferences. So the benefits are felt to outweigh the harm in this age group. So if you're between the ages of 50 to 74 and you haven't had a mammogram yet, you definitely want to talk to your family doctor.
So for women aged 75 and older, we can still offer to have you screened with mammogram if your life expectancy is at least 10 years. If, as a woman who is 75 or older, you want to be screened, the recommendation is to do a screening mammogram every 2 years. Several expert group recommendations do not explicitly state at what age breast cancer screening should stop.
Mammography in the form of 2D and 3D and film is the primary modality for breast cancer screening in the average risk woman. And at KSB, we do have 3D mammography. Ultrasound and MRI are more reserved for further evaluation to take a closer look. If you're at a higher risk of developing breast cancer, we might use those modalities to look closer. And then breast exams by your doctor or self exams aren't really recommended to be the only screening method. So sometimes patients say, hey, Dr. Johnson, I check my breasts all the time. I don't need a mammogram. Well, we definitely say that that's great that you do that, but it's not the sole way that we should be screening for breast cancer. But it is important for women to have awareness of what's going on in their breasts and to report any concerns to their doctor that they may have.
So there are some other special considerations for breast cancer screening. So if you have had a breast augmentation, the exact same guidelines apply to you so that we're able to screen the native breast tissue that you still have. If you have had a breast reconstruction following a breast cancer, mammograms typically are not routinely performed. Mammograms also are not routinely performed in pregnant women unless there has been a recent abnormality on a mammogram, then follow-up is actually encouraged. For biological males, routine mammogram screening is not recommended. And for women with breast dense tissue, digital mammography is preferred over films due to greater likelihood of detection of anything that's abnormal. No supplemental screening tests are actually recommended though. So just because you have dense breast tissue does not mean you have to have an extra ultrasound or MRI or anything in addition to the mammogram if the mammogram looks okay. Women who take postmenopausal hormone replacement therapy versus those who do not have any extra screening recommendations. And it previously was recommended after receiving COVID mRNA vaccines that you wait 4 to 6 weeks because of the concern for enlarged lymph nodes in your axillary area. But actually, they have removed that recommendation. So do not delay screening because of receiving a COVID vaccine.
Great. So I think that brings us to the end of our presentation. We hope we answered some of your frequently asked questions regarding breast cancer screening and mammograms. If you haven't yet gotten your mammogram done and you are between those ages of 50 and 74 or outside of that group at your higher risk, please do not pause, contact your family doctor and get that set up. Thanks again for joining us on today's virtual presentation platform. Have a great evening.
Thanks, everyone.